The folks at Medical Reimbursement and Management Services have been great about helping us prepare for and cut through the red tape of Medicare enrollment. President Stephen Buttice and Stephen Buttice's son, the second, are here today to discuss ways to make your coverage more efficient. Welcome back.
It's good to be back.
So we are less than a week away from the enrollment period, which begins October 15th.
Correct.
What do we need to know now?
Well, first of all, since we've been here last time, people would have received their ANOC, remember those initials, Annual Notice of Change. They should go through that, their notice of change, and look to make sure that their doctors are still in their network, that their pharmacies are still in their network, because there's been some changes there from the 2019 plans to the 2020 plans. Then they should also look at their benefits, of course, and make sure that their prescriptions are covered.
Now,
the new plan.
How does one determine whether or not the coverage that they have is efficient?
They can always come to us and we review their medications, and their doctors just make sure that they're all in network and find the most cost-efficient plan for that person.
And what if they're not? So let's say there have been some changes and your doctor is no longer in the network, or your specific prescription is no longer covered. What are your resources then?
Then you make a change, basically. You can do it with Medicare. Prime example of that, Yvonne, is CVS. Walgreens and CVS have had major changes. Walgreens is not in network, so in a major plan right now. So if people have that plan, they can no longer go to Walgreens. Those types of people that get in that situation, they're going to want to make a change come October 15th. And hopefully they'll use the advice of somebody in the industry locally, a professional, to help them. If not, they can go to Medicare.gov and make changes that way. But I would strongly urge them to use somebody who works with us all the time.
Now, is there a way to compare your plan with other options available?
There's a way to do that.
Yeah.
He knows it better than I do.
Okay, go ahead.
No, yeah, we use a resource that it allows us to type in the medications and the pharmacy of choice that they would like to use, and it compares all the plans that we represent, and it's a variety. So,
but that's nice, sort of a one-stop shop, so people can see it all at one glance, what one figures in and what the other figures in.
Right, so you're not kept to one company.
And so they have until October 15th, until when to make some of these changes?
December 7th.
And how do they go about doing that? Do they have to go through a professional like yourself?
They can do it Medicare.gov, and don't use Medicare.com, that's an insurance company, but Medicare.gov.
That's an important distinction.
That's very important, because they'll get bombarded with calls. And they could do it themselves, or they can call, and I'd call a local agency that brokers different companies, and then they could make the changes for you. It's a matter of either a telephone call, paper, or a computer entry.
Well, you guys have been a great resource for us. Hope folks will give you a buzz. Let's let folks know how they can get in touch with Stephen and Steve at Medical Reimbursement and Management Services. 693-1060 is the phone number, or you can reach them at mrms-inc.com. Gentlemen, thank you so much.